Allergies can be a serious problem, and among kids in the USA, allergies are on the rise. For new parents, knowing how to prevent and treat allergies can be confusing. And this month's issue of American Baby magazine has helpful tips for moms and dads. Now, Laura Kalehoff, executive editor of American Baby, is here with us this morning. Thank you for joining us.
Thank you for having me.
Now, when we have children, the biggest concern is obviously, are we doing something, or are we giving children something that they're getting sick? Now, these allergies, do they come from us?
Well, allergies are on the rise. No one knows exactly why, but there is a genetic component to them. So while about 15% of the general population has allergies, if you or your partner have allergies, your child has a 25% chance of inheriting some sort of allergy.
So when you're dating, is that a question you should be asking?
Right. Ragweed, pollen, or dust.
Now, what about milk? Baby's milk, cow's milk, are children lactose intolerant, or is it something different?
It's actually something different. It's an allergy to the milk proteins. So, and it's actually the most common sort of allergy in kids. And it's often realized when babies switch to cow's milk formula. If they have stomach upset, some of them have wheezing, blood in the stool, different issues that can come up.
That is scary. I mean, as a new parent looking in a diaper and seeing blood in the stool, that can be frightening.
Right. You should keep calm, but tell your doctor and let her know. So your doctor might suggest switching formulas. If you're nursing, sometimes babies react to the dairy in your own diet. So switching your diet can help with that. But the good news is that they're usually kids outgrow these allergies, the milk protein allergies.
Now, what about those rashes? So you see the baby rashes. Is that a sign of an allergic reaction?
It sometimes can be sort of a precursor or an early sign of a potential allergy. So 5 to 10% of kids get eczema, that itchy sort of rash, and often it's a sign that that could be down the pike.
So the magic moment, Laura, when we take our children away from the bottle and introduce solid foods, is that a time period where we need to be watching out for allergies?
You absolutely do. Most food allergies manifest in the first couple years of life, and there are 8 trigger foods that you should really be watching out for reactions to. They include foods like eggs, milk, soy, shellfish, regular fish, so you want to just be on the lookout. You don't necessarily need to delay introducing them. You just want to keep your doctor in the loop and make sure that you're following what's right for you.
And I'm thinking about breakfast, eggs. Clearly they're going to want to try some of my eggs, but I need to hold off on that, right?
You don't need to hold off, but just keep her informed.
So the big question, obviously, how do we prevent it, or how do we make sure, if they're going to have reactions, that they're not as severe?
Okay, well, one way to help prevent allergies is to breastfeed your baby for the first 4 months at least of her life. Can actually help stave off allergies, we found. Also, it's funny, pet allergies, it tends to be that in families with babies with at least 2 pets at home, they're less likely to get pet allergies.
So I should get the dog.
Get the dog before the baby.
So my family thanks you, and my future dog thanks you. Thank you very much, Laura Kalehoff, executive editor of American Baby.